Stage 5. Kidney disease, also known as end-stage renal disease, ESRD, is the most severe form of chronic kidney disease. At this stage, the kidneys lose nearly all of their ability to function effectively, resulting in the accumulation of waste products and excess fluids in the body, leading to severe health complications and the need for intensive medical intervention. Doctors typically treat stage 5 kidney disease with dialysis or kidney transplantation. Dialysis removes waste and excess fluid from the blood. However, there is growing interest in strategies to manage stage 5 kidney disease and potentially avoid dialysis. Conservative management focuses on symptom control and improving quality of life without dialysis. Nutritional therapy, certain medications, and lifestyle modifications also play crucial roles in managing the condition. The life expectancy of individuals with stage 5 kidney disease varies, but without dialysis or transplantation, it may be limited to a few months. However, with proper management and treatment, patients can live several years. Dialysis can extend life by 5 to 10 years on average, while kidney transplantation often provides the best outcomes, with many patients living 10 to 20 years or more post-transplant. In this video, we will discuss various strategies to manage stage 5 kidney disease and avoid dialysis, covering traditional treatments like dialysis and transplantation, as well as alternative approaches such as conservative management, nutritional therapy, medications, and lifestyle changes. Number 1. Conservative management. Conservative management is a way to care for chronic kidney disease, CKD, without using dialysis or a kidney transplant. For stage 5 kidney patients, it focuses on managing symptoms like fluid buildup, electrolyte imbalances, and uremic symptoms with medication, diet, and lifestyle changes. The goal is to keep the patient's quality of life as high as possible. This approach works by addressing the issues caused by kidney disease. It involves managing anemia, high blood pressure, and diabetes, as well as treating vitamin imbalances. Keeping blood pressure within a target range is essential to slow the progression of kidney disease and prevent cardiovascular complications. Medications such as ACE inhibitors, or ARBs, along with lifestyle changes, are used to manage hypertension. For patients with diabetes, maintaining blood sugar levels within the target range is crucial. This involves regular monitoring, appropriate use of insulin or oral hypoglycemic agents, and dietary modifications. A renal dietitian helps create a personalized eating plan that limits protein, sodium, potassium, and phosphorus intake. This helps manage symptoms and prevent complications such as hyperkalemia, high potassium levels, and hyperphosphatemia, high phosphorus levels. Another important strategy is to manage the symptoms of anemia that kidney patients may already have or are more prone to develop. For that, ESAs, erythropoiesis-stimulating agents, and iron supplements are used to treat anemia, a common complication of ESRD, to improve energy levels and reduce fatigue. In conservative management, a team of healthcare professionals works together. This team usually includes a kidney specialist or nephrologist, primary care doctor, nurse, dietitian, pharmacist, counselor or social worker, and sometimes a spiritual advisor. They involve the patient in decisions and help plan for future care, ensuring the patient's wishes are respected. Research shows that people who choose conservative management over dialysis can live for several years with improved or stable physical and mental health and spend less time in the hospital. Dialysis can be beneficial for some, but very challenging for others. Conservative management offers several benefits over dialysis for patients with stage 5 chronic kidney disease. It helps make life better without the tough process of dialysis, mitigates psychological stress, and allows patients to maintain greater autonomy and spend more time engaging in enjoyable activities. Number 2. Very low protein diet, VLPD. The very low protein diet, VLPD plan, is designed for patients with advanced chronic kidney disease, CKD, specifically those in stage 5. This diet restricts protein intake to reduce the burden on the kidneys and slow the progression of kidney failure. For stage 5 CKD patients, determining the right protein intake is crucial. The recommended protein intake is often around 0.6 to 0.8 grams per kilogram of body weight per day, but in a VLPD plan, it is reduced further to reduce the kidney's workload. The decision to adopt a VLPD diet plan should be made based on the patient's overall health status, nutritional needs, and the progression of their kidney disease. This diet is more effective in patients who are not yet on dialysis but are looking to delay the need for it. Choosing a VLPD diet plan over dialysis can have significant benefits. It allows patients to avoid the physical and emotional demands of dialysis, maintain a higher quality of life, and potentially extend the period before dialysis becomes necessary. The diet can slow the progression of kidney damage and help manage symptoms such as uremia, reducing the overall burden on the patient's health. However, choosing a VLPD diet requires careful and continuous monitoring. A 2018 review study found that as protein and energy intake decreased, various nutritional markers worsened with declining kidney function. This means that patients on a low-protein diet need very careful monitoring to ensure they get enough protein and energy. There is a risk that changes in metabolism, diet, or illness could lead to protein depletion, which is harder to correct in CKD or ESRD patients. The benefits of a very low-protein diet, VLPD, for stage 5 kidney patients can be significant, including delaying the need for dialysis, reducing symptoms of kidney failure, potentially prolonging life expectancy, and maintaining better overall health and quality of life. However, without careful management and proper supplementation, there are potential risks such as protein-energy malnutrition, muscle wasting, and other deficiencies. Number 3. Activated charcoal. Activated charcoal is a form of carbon that has been processed to have a large surface area, making it highly absorbent. It's commonly used to treat poisoning by trapping toxins and chemicals in the gut, preventing their absorption into the bloodstream. For stage 5 kidney patients, activated charcoal can be beneficial because it helps to manage symptoms by reducing the levels of toxins in the body. In advanced kidney disease, the kidneys are less able to filter waste and toxins from the blood. Activated charcoal works by binding to urea and other waste products in the digestive system, which are then excreted in the stool, thus reducing the overall burden on the kidneys. Activated charcoal is particularly useful in the later stages of kidney disease, specifically stage 5, when kidney function is severely impaired and the kidneys can no longer effectively filter waste. By helping to eliminate these toxins, activated charcoal can help alleviate some symptoms associated with kidney failure, such as nausea, itching, and overall malaise. However, using activated charcoal can have side effects. Common side effects include constipation and black stools, which can be alarming but are generally harmless. In some cases, it can cause more severe gastrointestinal issues, such as blockages or rarely perforations. Long-term use can also interfere with the absorption of certain medications and nutrients, so it should be used under medical supervision. Activated charcoal is typically administered in a healthcare setting under the supervision of a healthcare professional. It can be given orally as a liquid suspension or in the form of capsules or tablets. The dosage and frequency of administration depend on the specific condition being treated and the patient's individual needs. In a hospital or clinical setting, activated charcoal may be given through a nasogastric tube for patients unable to take it orally. Healthcare professionals monitor the patient's response, side effects, and medical history before administering it. They also provide instructions on proper usage and precautions. Number 4. Herbal medicine. Herbal medicine offers potential benefits for individuals undergoing dialysis as a complementary approach to conventional treatments. It can provide antioxidant properties, anti-inflammatory effects, and support for overall health and well-being. Some commonly used herbs, such as green tea, turmeric, and ginger, contain antioxidants that may help neutralize harmful free radicals and reduce inflammation, common complications of kidney disease and dialysis treatment. However, it's essential to understand that herbal medicine is not a substitute for dialysis. Dialysis remains crucial for managing advanced kidney disease by removing waste products and excess fluids from the body when the kidneys can no longer perform this function effectively. While herbal medicine can offer additional support, it cannot replace the vital role of dialysis. A study in 2021 looked into how herbal medicine works and its effects. It found that certain substances in herbal medicine, like silymarin, curcumin, resveratrol, amodin, and quercetin, can help fight inflammation and harmful substances in the body. Silymarin is well known for its liver protective properties and ability to reduce inflammation. Milk thistle seeds are the primary source of silymarin. Curcumin is a bright yellow compound found in turmeric and is widely recognized for its powerful anti-inflammatory and antioxidant effects. Resveratrol is a polyphenol found in the skin of red grapes, blueberries, raspberries, and mulberries, and in significant amounts in red wine. It is known for its potential benefits in reducing inflammation and protecting the heart. Amidine is found in rhubarb, aloe vera, and buckthorn. It exhibits anti-inflammatory and antioxidant properties. Lastly, quercetin is a flavonoid found in many fruits and vegetables, such as apples, onions, berries, grapes, and citrus fruits. It has strong antioxidant and anti-inflammatory effects. Including a variety of these fruits and vegetables in your diet can help you benefit from quercetin. The potential side effects of herbal supplements can include allergic reactions, stomach issues, and problems with other medications. Also, herbal supplements are not controlled in the same way as medicines, so they can vary in strength and quality between different brands. A study conducted in 2022 highlighted that while clinical and preclinical trials of plant extracts show benefits, there is also research indicating potential risks. Long-term use of certain herbal extracts may lead to chronic organ dysfunction due to the presence of harmful chemicals. This underscores the importance of caution and careful monitoring when using herbal medicine, particularly for extended periods. Number 5. Gum arabic. Gum arabic, derived from the sap of the Acacia senegal tree, has potential benefits for individuals with kidney disease. It is known for its ability to act as a prebiotic by supporting gut health and may reduce uremic toxins, but it cannot replace dialysis, which remains the primary treatment for advanced kidney disease. According to a 2021 study, oral supplementation with gum arabic has been shown to positively influence the rate of progression of chronic kidney disease in human patients. This effect was observed to persist for at least 6 months beyond the period of administration. Additionally, a study in 2020 demonstrated that gum arabic has potent antioxidative and anti-inflammatory properties, which can benefit individuals undergoing hemodialysis. Oral consumption of gum arabic at a dosage of 30 grams per day decreased oxidative stress and inflammatory markers in hemodialysis patients. Furthermore, a study conducted in 2018 revealed that long-term consumption of gum arabic had protective effects against adverse reactions from medications and baseline diseases in individuals with a solitary kidney under adverse conditions. The study found that gum arabic helped protect against damage to multiple organs, including the kidneys, blood vessels, teeth, and inflammation-related diseases. The potential side effects of gum arabic include gastrointestinal discomfort, allergic reactions, and interactions with medications. It's important to consult a healthcare professional before use, especially for individuals with kidney disease or undergoing dialysis, to ensure safety and effectiveness. Now, let's talk about the ultimate solution to stage 5 kidney disease: kidney transplantation. Unlike dialysis, kidney transplantation offers a more permanent solution to kidney failure. At this stage, individuals experience severe symptoms and complications that significantly impact their quality of life and overall health. A kidney transplant offers a potential solution by replacing the failed kidneys with a healthy donor kidney, allowing the recipient to regain kidney function and potentially lead a more normal life. However, not everyone is eligible for a kidney transplant. If a person has a serious underlying medical condition, a kidney transplant might be dangerous or unlikely to be successful. These conditions include cancer or a recent history of cancer, serious infections such as tuberculosis, bone infections, hepatitis, severe cardiovascular disease, and liver disease. Additionally, individuals who smoke, drink alcohol excessively, or use illicit drugs may not be suitable candidates for a transplant due to the increased risk of complications. To determine eligibility for a kidney transplant, individuals undergo a thorough evaluation at a transplant center. This evaluation includes physical, psychological, and familial assessments, as well as various tests on blood and urine samples. The goal is to ensure that the individual is healthy enough to undergo surgery and capable of understanding and adhering to the complex treatment regimen associated with transplantation. During the evaluation process, individuals also meet with a psychologist and a social worker to assess their psychological readiness and support system. The social worker evaluates the individual's financial situation and ensures they have adequate support post-transplant. If approved for a transplant, individuals can receive a kidney from a living donor, typically a family member, or be placed on a waiting list with the Organ Procurement and Transplantation Network, OPTN, for a deceased donor organ. If you like this video, give us a thumbs up and share it with everyone you care about. Thanks for watching, and see you in the next video.